Dental pain is a common subjective complaint of patients and presents as one of the most common causes of patients seeking emergency treatment. Thus, analgesics are considered as one of the most important drug groups in dental practice. While there are numerous analgesics, ibuprofen is considered as a first line therapy for acute dental pain. To tell us more about this nonsteroidal anti inflammatory drug, we are privileged to have with us this afternoon a clinical associate professor of the University of the Philippines, Manila College of Medicine, and consultant at the Philippine General Hospital Pediatric Department. Let me introduce to you our lecturer for this afternoon. Please welcome Dr. Maria Cecilia D. Alenea.
Good day, everyone. I'm sure we all agree that providing care to our patients is essential, even in the midst of this pandemic. And over the past few months, we have probably discovered creative and resourceful ways to communicate with them. Whether through face to face in the clinic or virtually through telemedicine, we continue to listen to our patients' medical complaints and manage them in the best and safest way possible, especially those suffering from pain and fever. Today, let me share with you some updates on the safe and effective use of ibuprofen, a drug that can be used in common childhood conditions that involve inflammatory pain. This is my disclosure. Let me begin with a French tittle-tattle that happened in the southwest part of France. On March 14, 2020, almost a year from now, and this was 3 days after the World Health Organization declared COVID-19 as a global pandemic, French Health Minister Olivier Véran wrote on his Twitter account that taking anti-inflammatory drugs such as ibuprofen may exacerbate infection. And this was based on just 4 cases of young patients with COVID-19 and no underlying health problems who went on to develop allegedly serious symptoms after using nonsteroidal anti-inflammatory drugs in the early stage of their disease. As physicians who firmly believe in evidence-based medicine, we know that our basis for the use of a particular drug depends on sound scientific proof. So let me share with you today very important facts that can debunk the statement of the French minister. These information from the experts should guide us on the way we should use ibuprofen. Shortly after the French minister tweeted that ibuprofen may be detrimental to the health of COVID-19 infected patients, the WHO issued a statement saying that there is no evidence of severe adverse events on the acute healthcare utilization, long-term survival, or quality of life in patients with COVID-19 as a result of the use of NSAIDs, particularly ibuprofen. In a video created by the Center for Disease Control, or the CDC, in the US, then Chief Medical Officer Dr. John Brooks stated that we have reviewed the scientific literature regularly and have spoken to colleagues, and at this present time, there is no compelling evidence that ibuprofen and other drugs like it can make you sicker if you have COVID-19. The Food and Drug Administration in the United States agrees with the WHO and the CDC statements saying that at this time, the FDA is not aware of scientific evidence connecting the use of NSAIDs like ibuprofen with worse COVID-19 symptoms. The European Medicines Agency, or the EMA, also states that there is, quote, currently no scientific evidence establishing a link between ibuprofen and the worsening of COVID-19, and they are continually monitoring this situation. Finally, there is now a paper published recently on ibuprofen use and the clinical outcomes of COVID-19 patients. A retrospective cohort study, it looked at the mortality and the need for respiratory support of 403 confirmed cases who took ibuprofen. The conclusion of the study was that in this cohort of patients, ibuprofen was not associated with worse clinical outcomes. So, why don't we have a review of how ibuprofen works so that it can remind us of what happens to the body when this drug is being taken? Let us watch this 1-minute video.
How does ibuprofen work? When injured, our body implements a natural mechanism of defense which activates cyclooxygenase 2. This protein converts a fatty acid in the cells, arachidonic acid, into prostaglandins and thromboxanes, which are the substances responsible for inflammation, pain, and high temperatures. When we take ibuprofen, the drug bonds with the cyclooxygenases. This cancels out any action or effects they may have, reduces inflammation, pain, and fever. Therefore, it is an analgesic and an anti-inflammatory drug. There are two types of cyclooxygenases. Cyclooxygenase 1 is always present in the organism and generates prostaglandin. In the stomach, for example, it protects the gastric mucus. Cyclooxygenase 2 increases during the inflammatory process. The action of ibuprofen on cyclooxygenase 2 interrupts the process that causes discomfort, but the drug also inhibits cyclooxygenase 1, thus preventing protective compounds from forming and making the gastric wall more vulnerable. So one of the main side effects of the drugs that inhibit cyclooxygenases is that they affect the gastric mucus. Of all the drugs available, ibuprofen is one of the best tolerated, but it is always advisable to administer it with food.
So, as you can see, the main function of ibuprofen is that it acts on your prostaglandin, inhibiting its release, and in the process prevents an increase in temperature, pain, and inflammation. For years, ibuprofen has been widely used by adults and children for the treatment of inflammation and acute and chronic pain. It has been noted to have a faster onset of action and provides longer duration of relief. Studies have shown that it can provide effective and sustained relief of inflammatory pain in common childhood diseases such as acute otitis media, pharyngitis and tonsillitis, post-operative, as well as dental pain. Let us just briefly talk about pain due to tonsillitis. In these pie graphs, you will see that viruses remain as the more common etiology for majority of sore throat cases. What is common between bacterial and viral tonsillitis is pain due to the sore throat, making swallowing difficult. Thus, relieving pain is also an integral part of sore throat management, and this can be achieved by giving pain relievers such as ibuprofen to lessen the discomfort caused by this condition. Ibuprofen is an effective and safe analgesic for mild to moderate post-operative pain, reducing the consumption of opioids. Studies have shown that it is more effective than your acetaminophen-codeine combination and has a longer duration of action in relieving post-operative pain. It is also as effective as your oral morphine after outpatient minor orthopedic surgery. In dentistry, where the maxillary and mandibular bones may be involved, mild pain involving these bones will benefit from ibuprofen. As pediatric dentists, we know that dental pain is a common cause of distress in children, and studies have shown that management of pain in this nature is still suboptimal even at present. Dental pain may be due to an underlying condition in the hard or soft tissues of the mouth or because of dental procedures. And scientific literature shows that oral analgesics can be safely used to manage such pain. Your NSAIDs have been shown to be more effective at reducing mild to moderate pain than opioids. Thus, the American Dental Association recommends that it be the first line of treatment for acute pain. Dental pain in children is usually caused by underlying conditions such as teething, dental caries, loose teeth, dental abscess, and gum inflammation. Ibuprofen works very well in alleviating dental pain as it reduces the inflammation that accompanies these dental problems. Ibuprofen has been noted to have a similar efficacy as that of your acetaminophen combined with codeine when it comes to providing pain relief. Studies show that there is no significant difference in analgesic failure and pain scores between the two. But children receiving ibuprofen have earlier, better functional outcomes, specifically play. Children receiving ibuprofen also significantly have fewer adverse effects, and both children and parents are more satisfied with it. Thus, ibuprofen is preferable to acetaminophen with codeine for the outpatient treatment of dental pain in children. Peri-procedural pain is probably one of the more common challenges that pediatric dentists have to hurdle, especially when dealing with fearful and uncooperative children. I'm sure it can sometimes even be a nightmare for some, as told to me by some of the parents of my patients. In this table are examples of anticipated peri-procedural pain levels according to the interventions that need to be performed on our patients. Apart from the application of fillings and dental prophylaxis, pulp treatment and simple extractions would be one of the more common procedures being performed in children, which may result in mild pain. The American Dental Association continues to recommend the use of an effective and safe oral analgesic in the form of ibuprofen, which not only provides pain remedy but also lessens inflammation due to the procedure that the child has undergone. For infants less than 50 kilograms, we give a dose of 5 to 10 milligrams per kilo per dose every 6 to 8 hours with meals, and this is for optimum comfort and pain control. For kids 12 years and older, you can give 200 milligrams as frequent as every 4 to 6 hours, keeping in mind that the maximum dose is 1.2 grams per day. Older kids may receive the same dose as adults. Here is also an alternative dosing table based on the age of the children that we are treating. Pain level should also be considered. For adults, for instance, the dose may be increased or may be combined with equally safe analgesics for better control of moderate to severe dental pain. In the UK, the recommended dose for adequate pain control of dental pain in children is 10 milligrams per kilo per dose. There are instances, though, when dental pain would require the use of antibiotics and not just analgesics. Signs of inflammation, such as pain, swelling, redness, and warmth, should be managed by effective anti-inflammatory medications such as your ibuprofen. But if in the presence of abscesses or draining sinuses, drainage of the pus and discharge should be performed for the pain to totally disappear. Clinical conditions where antibiotic treatment is indicated include those with systemic symptoms such as fever, body malaise, and lymphadenopathy, to name a few. Trismus, which may indicate infection, but also trauma or even cancer, may also require antibiotic therapy. Other indications include prophylaxis for patients with cardiac problems or orthopedic prosthesis, and those who are immunocompromised or have undergone organ transplantation. As mentioned in the previous slide, systemic findings in the presence of infections such as apical abscesses, cellulitis and osteomyelitis, and necrosing ulcerative infections in the periodontal area require antibiotics that are effective against the overgrowth of certain organisms found in the oral cavity, including the bones. Here are some evidence-based recommended antibiotics used in pediatric dental practice based on the nature of the infections that we treat. For necrotizing ulcerative gingivitis, for instance, the common etiologic agents are anaerobic bacteria and spirochetes such as Treponema. Though more common in adults, it can be found among malnourished and immunocompromised children, leading to necrotizing ulcerative periodontitis and even spread as necrotizing stomatitis if left untreated. Apart from local oral treatment, your amoxicillin plus or minus your metronidazole acting in synergy are primarily used for this condition. For aggressive periodontitis, amoxicillin is also the drug of choice, which can be complemented with analgesics if pain is present. Aside from its safety profile as an analgesic and antipyretic, in terms of efficacy, ibuprofen has a faster onset of action, which would usually be felt 15 to 30 minutes earlier than paracetamol, and it can maintain an afebrile state longer for about 6 to 8 hours. That's why you can give it in this interval. Its recommended dose is 5 to 10 milligrams per kilo per dose, as I mentioned earlier. So even with a low dose and less frequency, ibuprofen proves to be an effective pain reliever. What about its ability to provide comfort to children in pain? In this study, within 24 hours of intake, almost 70% of the children in the ibuprofen group were more comfortable, less distressed looking, and complained of less pain compared to the almost 45% in the paracetamol group. Better sleep patterns were also noted in the ibuprofen group. Ibuprofen has the same incidence of side effects, both overall and GI, as paracetamol, and with a higher risk of hepatotoxicity and increased incidence of asthma in your paracetamol. Caution, though, should be exercised if ibuprofen is being given to dehydrated patients, since it can also cause vasoconstriction of the afferent arterioles for your very dehydrated children, and this may decrease blood flow to your kidneys. Ibuprofen remains to be the drug of choice in the treatment of inflammatory pain in children because of its efficacy and safety and its ability to provide comfort to these children. In summary, there is currently no scientific basis showing a link between ibuprofen and the worsening of COVID-19 infection, so it is still something that you may use depending on the case of the individual. And it continues to be widely used for the treatment of inflammation, acute and chronic pain, with faster onset and longer duration of relief, especially in the management of sore throat, otitis media, post-operative, as well as dental pain. In these conditions, adequate pain management is essential, and giving ibuprofen will certainly help alleviate the pain and discomfort that they may cause. Thank you very much for listening. Let us all remember that this too shall pass. Let us continue to pray and wait and trust in the Almighty who alleviates our pain and discomfort. And in solidarity with our fellow healthcare workers, let us all stay safe and healthy. Thank you.
That was indeed an eye opener for many of us on how effective and safe ibuprofen is, especially for dental pain in children. Unfortunately, Dr. Maria Cecilia cannot be with us
for the question and answer, and so we will go directly to the awarding of certificates. The Pediatric Dental Society Incorporated presents this certificate of appreciation to Dr. Maria Cecilia Alinea in grateful recognition of her earnest enthusiasm and invaluable support during the 28th PPDSI Annual Convention. Given this 22nd of March 2021, signed Dr. Lavinia Marie H. Lucido, PPDSI Scientific Committee Chair, and Dr. Teresa Pedron Garcia, PPDSI President and Annual Convention Overall Chair. Sir Nico. Sir Nico is a representative of Pediatrica to receive the certificate in behalf of Dr. Alinea.
Hi, Doctora. Good afternoon. Again, in behalf of Doctora Maria Cecilia Alinea, I would like to say thank you to Philippine Pediatric Dental Society for having us and allowing us to present our own brand of ibuprofen in Dolan. And with that, Doctora, I would like to conduct a brand presentation on the features and benefits of our brand, Dolan.
Stay tuned, everyone, as Sir Nico will still be having a product presentation. For the meantime, we would like to thank our major sponsor, Essentials for Daily Living Corporation by Doc Juan, Curapox Philippines, MyMeds PH, and for our minor sponsors, Pediatrica Inc., Dolan, Alpha Gargle by Pascual Laboratories Inc., and Dur Dental.
Again, good afternoon, everyone. Doctors, medical practitioners, good day. I am Nico Gutierrez, the brand handler of Dolan, and I am from Pediatrica RX team. So it is a team that handles all the brands of Pediatrica that are purely doctor promoted. So for this afternoon, doctors and dentists, allow me to present to you our own brand of ibuprofen Dolan. For kids, fever and pain, bilis galing sa Dolan. So again, doctors, I would like to remind you, Ibuprofen Dolan. With this, we are offering and launching Bilis Galing Fever and Pain Relief with Dolan. As you very well know, doctors, ibuprofen and Dolan has a lot of advantages versus another antipyretic molecule. First, it has a faster onset of action. It works within 15 minutes upon administration. It also has a longer afterbell state, or longer duration of action, meaning doctors, it lasts up to 6 to 8 hours versus 4 to 6 hours of paracetamol. With this, your patients will take Dolan less frequently. And lastly, since it is an NSAID drug, ibuprofen and Dolan has an anti-inflammatory property versus none of paracetamol. With that, it works with pain caused by inflammation. So again, doctors, with all of these, we're launching Bilis Galing versus Kids Fever and Pain. Again, for kids fever and pain, Bilis Galing sa Dolan. As you very well know, doctor, that mothers become worrisome if may lagnat yung mga kids nila. Especially if hindi bumababa agad and hindi nawawala yung mga pain after administering fever and pain medicine. With that, may I offer to you the Bilis action versus fever of our ibuprofen and Dolan. As you very well know, doctor, that ibuprofen and Dolan works within 15 minutes in bringing down kids' fever. With this, you can provide comfort especially to our worrisome mothers with kids having fever. Again, for kids' fever and pain, Bilis Galing sa Dolan. As you very well know, doctor, that pain management is an important part of management, especially with your sick patients. With that, doctor, may I offer to you Galing versus Pain brought to you by our Ibuprofen Dolan. It is widely used for acute and chronic pain and treatment of inflammation, with faster onset and longer duration of relief. Also, it provides effective relief of inflammatory pain in the following conditions: dental pain, post-operative pain, and even for acute otitis media, pharyngitis, and tonsillitis. Again, doctors, for kids' fever and pain, Bilis Galing sa Dolan. We know, doctor, how important it is to provide ease of administration among your pedia patients. And if you talk about fever and pain medicine, we have Dolan. Dolan comes in yummy orange flavor with Taste Right technology, so patients will taste the flavor and not the medicine. With this, you are assured of patient compliance. Likewise, ibuprofen and Dolan provides lesser dose at 5 to 10 milligrams per kilogram per dose compared to 10 to 20 milligram per kilogram per dose of paracetamol. With this, it is easier to give and administer for younger kids. Again, doctors, for kids, fever and pain, Bilis Galing sa Dolan. And for tooth and dental infections, my dear doctors, we also have our own brand of amoxicillin and Hymox. Make the confident choice in bacterial infection, especially during your dental practice. Again, with that, doctor, I would like to say thank you very much for the opportunity you've given our Ibuprofen Dolan.
Thank you, Sir Nico, for that additional information. We will now award you with this certificate of appreciation. And the citation reads, the Philippine Pediatric Dental Society Incorporated presents the certificate of appreciation in grateful recognition to Dolan Pediatrica on the 28th PPDSI Annual Convention, given this 22nd of March 2021, signed by Dr. Lavinia Marie H. Lucido, PPDSI Scientific Committee Chair, and Dr. Teresa Pedron Garcia, PPDSI President and Annual Convention Overall Chair. And Dr. Christine Irola, PPDSI Awards Committee Chair.
Again, Doctora, on behalf of Pediatrica and Unilab, thank you for the opportunity you've given to us.
Thank you, Dr. Nico, again. Please support our traders, Right Arm Trading, Tesco Dental Philippines Incorporated, St. Patrick's Medical System Incorporated, Jan Drug Global Traders Corporation, Budget Dental Supply Corporation, Auris Oral Implant Solution Incorporated, and Phildent. Don't forget to visit the trade hall in the lobby. And remember that the trade hall will be open 24/7. May I remind everyone for the upcoming lectures to log on My Meds and not to watch it in YouTube, or your attendance will not be counted. You will have to comply with a certain number of minutes before you can access the evaluation form and certificates. Please stay tuned and watch the infographics on how to navigate and claim your certificates.